What do you tell families whose diagnosis has changed?
Uh, when we change the diagnosis for families who come to the vascular anomalies center clinics with their children or with themselves, we typically go through a long introduction, basically explaining the basic components of the disease and explaining why this part of the disease is called this name and why the older names that have been dropped from the classification are no longer used and shouldn't be used because they could certainly lead to improper treatment. The response is variable. It could be certainly a simple inquisition about more information, asking about how to change the diagnosis, how long should we continue with this treatment or that treatment, what is good and bad for a child with this diagnosis based on the new diagnosis. Uh, Occasionally, it's difficult for the family just to accept a new diagnosis while they lived with another diagnosis and adjust literally their life to live, or the child also adjust his life or her life to live with such a diagnosis. That can be many, many years of management and treatment and follow-up visits and imaging studies and very expensive clinical course of treatment. Now, suddenly you're telling them that the diagnosis may be incorrect or imprecise, and that may be reflected on the management approach. I completely understand it. It can be very difficult to accept after all these years. Now you have to start again with a new diagnosis, a new name that you may not be familiar with, and start another workup process that can be as lengthy as the first one. But typically, it's not actually requiring a lot of workup or a lot of expensive tools to change the diagnosis. Most of the time, patients come to the hospital or to our center fully investigated, and we request them actually to get the tests and the studies that we need before they come to the hospital. So when they come to the clinic visits, they're ready to be managed, investigated, and treated based on the examinations and the tests they brought with them. That will make it easier for them, as many of them are coming from fireplaces and from outside the state. So that will save them time and also make the clinic more efficient.